WisconsinEye's Campaign 2024 programming is sponsored by Wisconsin Counties Association, Nicolet National Bank, Wisconsin Hospital Association, Operating Engineers Local 139, the Wisconsin Realtors Association, the Wisconsin Laborers District Council, and North Central State's Regional Council of Carpenters. To support programs like this, please consider a tax-deductible donation at wiseye.org/donate or by texting WisCI to 44321.
Representative Lori Palmeri of Oshkosh is the Democratic incumbent candidate for the 54th Assembly District. The election is November 5th. Representative Palmeri, welcome to WisconsinEye.
Yes, thank you for having me back.
This is my
second time.
Can you tell us what is your campaign's key message? Why are you running for re-election?
Sure. Well, the Palmeri campaign is really a purpose-driven campaign, and the purpose being protection of our people in the 54th and in Wisconsin, whether it's protecting the veto, protecting water quality, women's rights, health care, public education, problem solving for those people.
So if you're reelected, what's an example of a bill that would be a priority for you to introduce right out of the gate?
Yeah, right out of the gate would be absolutely investing in our PFAS and lead removal for our water quality and protecting our water quantity.
So you know that if you're reelected, you're entering during a biennial budget year and the state's projected to have more than a $4 billion surplus. What are your top two spending or priorities for use of the surplus funding?
Well, I kind of divided it up into a pie. We've been working on this for a little bit. So first off, $1.5 billion I would put towards housing, aggressively attacking our shortage of housing stock, affordable housing stock, accessible housing stock, especially as it relates to our workforce and our working families. Secondarily, I would look at $1 billion for public education, whether that's pre-K to K through 12 and child care. So those are the top two. After that, $800 million towards UW, $500 million towards transportation, and $500 million towards lead abatement and PFAS removal.
What about tax cuts, tax reform? Does that fit into your platform?
You know, we have to look at, I think, all kinds of ways of helping the Wisconsin population, and part of that would be, I think, reducing those taxes because we are over-reliant on property tax in Wisconsin. But I think there's multiple approaches to that, and I'd really like to see what our options are at budget time.
You mentioned supporting a big investment in K-12 education. What do you think is working well in K-12 education, and what do you think really needs to change?
What I think is working well is that our public is much more engaged. You know, the public education system has been challenged by many referenda, right? And I think that while referenda can be kind of a dirty word, the public participation and the engagement that's coming out of that is giving us more direction and more specifics. They want to see us fully funding our special education. They want to see us fully funding our academic support of students and our teachers, right? We have to have teachers who are compensated, our child care workers who are compensated in a way in which they can afford to live in the communities they work.
You also mentioned supporting an investment in higher education, the state's four-year colleges, two-year colleges, technical colleges. What does the future of that system look like to you, and where specifically would your proposed investment go?
Well, I will say, after listening to about 5 hours of the Special Legislative Study Committee just a few days ago that came out, they're making, I think, 23 different recommendations. The UW system is asking for about $850 million. We absolutely have to invest in things that are not only attracting, but also retaining our enrollment, as well as our staff and our professionals who are working there. Our buildings have to compete. Right now, we're ranked 43rd in the nation, and that's just not acceptable. I live right next to UW Oshkosh. I'm an alum. I went to UW Milwaukee. That would not have happened for me as a non-traditional grandmother going back to school were it not for access and that funding.
What do you see as the state's largest workforce development challenge, and how would you propose to address it?
I can't say that there is any one thing, but I will say it goes back to housing and childcare and transportation. Obviously, they have to have access to health care as well to have a healthy workforce. But if they don't have a place to live that's affordable and accessible, and we don't have childcare for those workers, it's not happening, right? So I think it's a multi-pronged approach.
I have a few more workforce questions for you. Investments in public and energy infrastructure grow our state's economy. This also provides an opportunity to invest in our state's workforce, but currently there are no requirements for hiring local workers. Would you support a state resident hiring requirement for state, local, and utility scale infrastructure investments?
I would support that, and I also would support those folks who want to move here to Wisconsin, kind of like a transition, if you will. So, it's interesting. I hear some of the different labor organizations and folks talking about what they call trunk slammers, right? People just come in, they do a quick job, slam the trunk, and they're back out to Illinois. And no offense to Illinois or Minnesota or surrounding states, but certainly we do have to make sure that our Wisconsin workforce is healthy, and that means making sure that there is that availability and those requirements. At the local level, I would leave that up to local control, home rule.
Employee classification is an issue in the construction industry. Some employers misclassify workers as independent contractors or pay them in cash off the books. This lowers costs by avoiding payroll taxes and unemployment insurance, and it puts compliant companies at a disadvantage when bidding on projects. Plus, misclassified workers may be denied minimum wage protections or overtime pay. Are you aware of this issue, and what do you think should be done about it?
I'm intimately aware of this issue. I actually, and many of us have, side hustles or day jobs that we work, and I work as a medical courier. It's kind of like Uber for medical specimens, right? And I use my vehicle for that. My company is being very responsible. They treat us as employees, even though we're using our vehicle. We have access to purchase health care. We have mileage reimbursement. We have different things. And even though you might be doing that job with some independence, it's very prescriptive on the criteria. And I think that's, by design. But those who are kind of taking the shortcuts to help themselves out and harming those workers, it's very exploitative to folks who are entering the workforce or who have limited means, or maybe they only have childcare available by auntie at night, so they've got to take this other job. So I absolutely think that misclassification plays a big role.
And so what should the state do about it? Any ideas?
I believe that we have to probably provide not just some education, but some enforcement of that, because regardless of whether or not you have the statute on the books, if there's no assistance or educational component to support that implementation, it's not really very impactful.
Moving on to housing. Affordable housing, as you've mentioned, is an issue in Wisconsin. Some support government-imposed rent control to maintain affordability for renters, while others argue keeping rent artificially low will decrease the rental supply, resulting in increased prices. Tell me more about your sense of housing as an issue and what you think would best address rental housing affordability. Is it rent control, building more rentals, or some other solution?
It's all of the above. And I will say, especially in our district, the Metropolitan area that is Oshkosh, Neenah, we saw a 106% increase in rentals between 2020 and 2024. So we went from like roughly $880 a month median rent to $1,885 roughly. So it's a combination of those things, adding to the supply, but also giving some not just sticks, but carrots for landlords and investors to, hold that line. I've got a $40,000 a year high school teacher, 6 years into her career, she said, I'm making $40,000 a year. I have 3 rent increases. I may not be able to continue to live in my community and do these other things with my kiddos, right? So we have to have a combination of those things. We need to look at accessible dwelling units and helping folks to fund those. That's like a low-hanging fruit where we could add additional units onto existing older housing stock. It needs to be in a safe way and a responsible way. We need to look at adaptive reuse of institutional and commercial, which we have a bipartisan package that we passed last session. And I'm proud that I introduced a bill for rent control. Let's return that back to local control, home rule, to municipalities that know their communities best. If they want to implement, a cap of a percentage of how much, and then put these things together in partnership. No single answer, but we have to do it in a bipartisan fashion.
Moving on to healthcare. Medical systems are facing numerous headwinds in the form of inflation, workforce development, and issues around Medicare and Medicaid reimbursement, resulting in fewer services and even the closure of a hospital system in western Wisconsin. What would you do to preserve access to care and prevent future closures?
Again, no simple answer there, but we certainly absolutely must take the Medicaid expansion. And we also should look at increasing those Medicaid reimbursement rates for our providers so that they can continue to provide. I mean, it's not just western Wisconsin that's seeing somewhat of an exodus. We've seen a prenatal unit close down in one of our local hospitals in the Fox Valley. We've seen some other opportunities for more health care providers coming in, but mental health resources and substance use disorder under that parity level of health care, right? Not enough. We also need to look at the broadband. And I know there's some federal dollars coming in there, but we have to make sure that broadband, especially in the rural areas, for those telehealth opportunities. No, they're not going to be able to look at that cyst on your hand very closely, but if you can get some of your healthcare needs supplemented before having to drive, 45 minutes to an hour. But again, multiple approaches to that.
You referenced just now mental health care, growing concern in Wisconsin for state and county budgets. Tell me more about what you're hearing on that issue and what are some solutions?
Yeah, certainly. And I served on the Mental Health and Substance and Alcohol Abuse Prevention Committee. We met 3 times total, all of last session. That is not acceptable. On the mental health, what I'm hearing from Counties Association is there's going to be an emphasis in their budget priorities, and I'm hearing that from rural areas, from urban areas, is that we need to not only help with some of the mobile crisis response, mobile response, but also crisis services at the same time. Because right now it's like a bottleneck squeezed into, particularly Winnebago County and Mendota, right? And we're seeing so many people that are human warehoused incarceration as a result of not having, it's like a de facto mental health, but they're not getting that kind of treatment. And we're over incarcerated compared to some of our neighboring states, right? And I really believe that between investing in our education, investing in mental health, we could potentially get a little bit more on the level with some of our peer states.
How should Wisconsin move forward on the issue of abortion?
Number one, it is not my place as an elected official to get in the middle of a woman's decision in her health care matters. I know that we absolutely must return full access to abortion care so that we don't push our young women out to other states for getting the services that they need. And whether or not, it's just not my place. And we are put in that place of being in this battle over very simple health care.
Any number of weeks do you support?
I don't even get that. I won't even go there. That's up to a woman and her healthcare provider.
What are the pressing transportation needs in your district, and how important is it that these needs are addressed and for the state to keep on schedule with the reconstruction of aging interstates and significant corridors of commerce?
So in our area, of course, we see a lot of Highway 41 traffic. It is an artery that runs through the upper northeast portion of the state. With background in urban planning, theory and in practice, you see much of what's called a spatial mismatch, where people are living and where they're working. What happened in 2020? People solved some of that with remote work, right? It was out of necessity, but what did we learn from that? What I will say is two words that folks need to think about: tolls and trains. We need to look at those as options. And there is an opportunity for a spur, a passenger rail spur from Milwaukee all the way up to Green Bay. That could alleviate some congestion, save taxpayer dollars, and free people up to have a little less stress in their commute, right? So I think those are two pieces, but it's also about building transit-oriented development. As we're building that housing, how thoughtful are we being about where it is co-located near transit?
What about PFAS and other water contaminants? They're certainly a growing concern for Wisconsinites. Do you see this as an important issue, and how would you address it?
When I ran for city council in 2016 and I was successful, the very first thing that I did with my city council was ask about, and we got a lead notification when construction is being done on your street, because it shakes that stuff loose. It's not an Oshkosh issue. It's not a Northeast Wisconsin issue. It's statewide. It's nationwide, right? But certainly we have to make some investments on lead removal and PFAS removal and mitigation, and removing those things from our consumer product purchases, right? So I think that it's a really comprehensive thing, but let's not forget about copper. There are a number of municipalities who are facing, mandates for removal of the lead lines, but also copper, as well as some of those communities who are impacted by PFAS. But again, we need to invest in not just the quality, but the water quantity as well.
We are down to our final two questions.
Yes.
How would you describe the leading differences between you and your opponent?
Leading difference between myself and my opponent, I don't know him very well. I met and introduced myself at the 4th of July parade, but I know that he was recently elected to the county board and probably cares about his community. But he hasn't really participated, or, we just haven't heard much from him. And I think my experience on the council, 7 years and 2 terms as mayor, I know the people of my district's issues. I know their needs. And they trust me that I'm listening to them and will carry their message.
Well, final question. Let's say you're reelected and you get this magic wand you can use in the state capitol to resolve one issue in a way that brings all people and parties together. What's the issue, do you think?
I love the magic wand question. I would say that it's about looking at true bipartisan work. And if you don't participate, that we should potentially look at a little timeout and or fines for not doing your job, for not holding hearings. Let's look at the idea of extending our legislative session and getting more work done and less arguing.
Well, thank you, Representative Lori Palmeri of Oshkosh, the Democratic incumbent candidate for the 54th Assembly District. The election is November 5th. Lori Palmeri, thank you for talking with WisconsinEye.
Thank you for having me.
This programming is brought to you by our generous sponsors. Thank you for watching.